Have you ever stopped to think your eyes may be trying to send you a warning? Sometimes those small changes in vision that seem harmless can be a sign of something much more serious. And the worst? Most people ignore these symptoms until it's too late. If you have already noticed your vision getting blurred out of nowhere, your eyes getting more yellowish or even sudden flashes of light, be aware. These can be clues that your body is facing serious health problems such as diabetes, hypertension, liver disease, or even a possible stroke. In this video, you will discover 7 eye signals that may be revealing something urgent about your health and a surprise bonus that can literally save your life. Do not skip any part, because this may be the information you or someone close you need to act before it's too late. Do you know that sudden difficulty to see closely or from afar? Blurred vision can be a classic sign of diabetes. Excess blood sugar affects the small blood vessels of the eyes and may lead to diabetic retinopathy. At first it may seem passing, but if not treated, it may cause permanent loss of vision. If you have already noticed this change for no apparent reason, it is worth jumping to the ophthalmologist. Now, if the vision is suddenly blurred, without warning, the situation may be even more serious. Strokes and migraines can also cause temporary or permanent blurred vision. Imagine being driving and, out of nowhere, the world around you loses its sharpness. Don't ignore this symptom. If you come with dizziness or strong headache, seek medical help immediately. If one day you look in the mirror and notice that the white of your eyes is yellowish, beware. This can be a sign of jaundice, a problem often linked to liver disease such as hepatitis, cirrhosis, or gallstones. Its liver is responsible for filtering toxins and processing bilirubin, a pigment produced by breaking the red blood cells. If something goes wrong in this process, bilirubin accumulates in the body and causes this yellowish color. But the yellowish eyes do not walk alone. Be aware of other symptoms such as intense fatigue, dark urine and abdomen pain. And look, it's no use just drinking more water or sleeping better waiting to pass. If you notice this change, seek a doctor as soon as possible. The liver is a silent organ, and when it begins to give visible signals, it means that something may already be in an advanced stage. Better to prevent sorry, right? And you feel dry eyes all the time, as if you were facing a fan-connected fan. It can be more than just excess screen. Although prolonged use of electronics actually reduces eye lubrication, chronic eye dryness may indicate something more serious: Sjogren's syndrome, an autoimmune disease that attacks the glands responsible for tears and saliva production. The result? Constant discomfort, feeling of sand in the eyes and even difficulty swallowing. And the problem doesn't stop there. Autoimmune diseases such as rheumatoid arthritis and lupus can also affect eye health, making vision blurry and eyes angry. If, besides dryness, you feel joint pain, extreme fatigue or dry mouth, don't ignore these signs. Keeping your eyes hydrated with lubricating eye drops can help, but if the problem is persistent, it is essential to look for an ophthalmologist and a rheumatologist to investigate deep. Your body may be asking for help. If by looking in the mirror you have realized that your eyes are more jumping than normal, it may be a sign of base disease, a condition caused by a hyperactive thyroid. This disorder causes the immune system to attack the tissues around the eyes, resulting in this effect of protruding eyes. And not stop there, other symptoms include sudden weight loss, anxiety, tremors and accelerated heartbeat. If you are always tired, sweating more than usual and with this wide eyes appearance, don't ignore these signs. Base disease can affect vision and even lead to heart problems if not treated. A simple blood test can detect changes in thyroid hormones, so seek a doctor if you notice something strange. Your look says a lot about your health and he may be asking for help. Do you know those spots that look like small shadows or cobwebs floating in your vision? These are the floaters, and in most cases they are just gel particles inside the eye. But if you suddenly start seeing many of these spots accompanied by flashes of light, this can be a serious warning of possible retinal detachment. And here there is no time to waste. This is a medical emergency that can lead to permanent loss of vision. Imagine as if it retains it, the light-sensitive layer inside the eye was detaching from the eye wall. If this happens, the vision can be cloudy, dark, or with a curtain covering part of the visual field. If you notice these signs, go to the ophthalmologist immediately. Treatment may include laser surgery to prevent irreversible damage. So nothing to expect to see if it gets better. Your vision depends on your speed. If you suddenly start to see everything duplicated, this can be a warning sign of your brain. Double vision may indicate problems in the eye muscles, but may also be linked to serious neurological issues such as stroke, multiple sclerosis, or nerve damage. If this symptom arises out of nowhere and comes with dizziness, weakness, or difficulty talking, go to the emergency room immediately. Interestingly, double vision can affect only one eye or both, and this helps to identify the cause. If it closes an eye and duplication disappears, the problem may be in the muscles or eyes that control the eyes. But if the vision remains duplicated in a single eye, it may be something within the eyeball itself. In any case, double vision is never something to ignore. See a doctor to understand the cause before it becomes something more serious. Did you wake up with your eyes looking like a sleepless night? It may be just tiredness or irritation, but if red persists, it is good to turn on the alert. Glaucoma and high blood pressure can cause blood vessels to break inside the eyes, resulting in this reddish coloration. The danger. In the case of glaucoma, increased eye pressure may damage the optic nerve and lead to loss of vision without notice. And don't stop there. If blood pressure is always high, it can compromise eye circulation, increasing the risk of eye stroke and even affecting the retina. So if your eyes are red frequently, accompanied by headache or blurry vision, don't ignore. Measuring pressure regularly and visiting an ophthalmologist can avoid serious problems. After all, seeing well is a privilege that is worth protecting. Imagine seeing normally and suddenly one eye simply darkens or is blurry. This can be a sign of something serious and urgent: an occlusion of the retinal artery, which prevents blood flow to the eye. This lock can be caused by a clot, functioning as an eye minivque. And here there is no half: the faster you act, the greater the chances of recovering your vision. This type of problem may indicate a higher risk of stroke, as the same factors that cause retinal blockages can also affect the brain. If this happens to you or someone close, go to the hospital immediately. Time is essential to avoid permanent sequelae. After all, vision is one of our most precious senses, and taking care of it can save much more than just the eyes. Your eyes are like windows for your health, and ignoring the signs they send can be expensive. Now that you know these symptoms, pay attention to what your body is trying to say. Did you notice any of these changes? Don't wait, seek a doctor and take care of your vision before it's too late. So, has any of these signs happened to you or someone you know? Leave your comment and share this content so that more people can prevent each other. Oh, and don't forget to subscribe to the channel and activate the bell to continue receiving valuable information about your health. We see each other in the next video.